Welcome to House Calls. I'm Martin Folse, and joining us is our expert in the field of ear, nose, throat, and sinus, Dr. Patrick Hagan, a familiar face. You've seen him on here many times before. Let's talk about sinus. We've talked about chronic sinusitis, but don't we have to understand what a normal sinus is first?
Absolutely. Before you can understand any disease process, you have to understand what normal is, and that's a great question. Normally, the septum divides the nose into a right and a left half. The sinuses have room to drain into the nose, and they're not obstructed. These turbinates, their purpose is to act as the radiators of the nose. They give off warmth and moisture to humidify and prepare the air to go into the lungs, and even the nose hairs play a role in filtering out pollution.
It's such a complicated looking thing, but we think of the nose just for smelling and breathing air, but a lot more to it, isn't it?
Yes, sir. Especially the preparing the air to enter the lungs and filtering out pollution and giving warmth and humidity. And the things that can go wrong sometimes is if a patient from an old football injury, such as an athlete as yourself, has a deviated septum, or these turbinates are enlarged from allergies or colds, or there's any other abnormality that someone was born with.
Well, we appreciate you explaining a normal track for us, and in weeks to come, we'll talk more about it. Thanks for joining us. All right. Once again, Dr. Patrick Hagan, an expert in the field of ear, nose, throat, and sinuses. We'll see you again tomorrow night on House Calls.